Hi, my name is Kailani Timmons, and I'm a second-year pharmacy student at the Daniel K. Inouye College of Pharmacy at the University of Hawaii in Hilo. I am here to present the prevention and management of high cholesterol. Cardiovascular disease is the leading cause of morbidity and mortality in the United States. Cardiovascular disease is caused by atherosclerosis. Atherosclerosis is a buildup of plaque in and on our arterial walls. Over time, this will lead to decreased blood flow and plaque bursting or breaking off, leading to blood clots that may cause complications such as stroke, peripheral artery disease, or heart disease. An artery's job is to be flexible and elastic to carry blood away from the heart and toward other tissues and organs. When plaque builds up, it prevents our organs from getting the necessary nutrients and oxygen they need to function. Plaque buildup is composed of fatty deposits, also known as cholesterol, that clog arteries and thicken blood vessel walls. Plaque accumulates over time, and this is why it is referred to as a buildup. Buildup may start for people in their late 30s or worsen when they reach their 50s or 60s. Depending upon the amount of plaque and how quickly it builds, it can cause a partially or fully blocked artery, causing several health issues. How can you tell if you have plaque buildup in your arteries? Unfortunately, there are no symptoms to plaque buildup. This is why it is important to manage your overall health, especially your cholesterol. Controlling your cholesterol helps us control the amount of plaque in our arteries. Total cholesterol is a measure of all the cholesterol in our blood. It includes our high-density lipoprotein, our low-density lipoprotein, and triglycerides. High-density lipoprotein, also known as our good cholesterol, is like a vacuum cleaner for our cholesterol in our body. When at healthy levels in our blood, it removes the extra cholesterol and plaque, ultimately helping reduce our risk for heart disease, heart attack, and stroke. Low-density lipoprotein is also known as our bad cholesterol. In this one, we must keep in check. LDL carries our cholesterol to our arteries, where they may collect in our vessel walls and contribute to plaque formation known as atherosclerosis. Triglycerides is another type of fat in our blood. Having high levels of triglycerides in our blood can increase our risk for heart disease, resulting from excess foods that we consume, especially high carbohydrate foods such as potatoes, white bread, and white rice. In order to decrease heart disease, we should have low triglycerides and LDL and an increase HDL. Our cholesterol goal is to be within normal range for total cholesterol below 200, LDL below 130, HDL 50 and higher in women, 40 or higher in men. Our goal is to achieve and maintain a normal triglyceride level below 150. But not to worry. With a combination of diet, exercise, and medications, we can manage our cholesterol levels and decrease our risks for heart attack and stroke. It all starts with making healthy choices. The problem is a lot of the foods that we enjoy eating are high in fats and cholesterol. This includes hamburger steak and fried foods, such as lechon kavale and fried chicken. Other foods that are high in carbohydrates, such as white rice and macaroni salad, should also be eaten in moderation as it can contribute to increased triglycerides. The key to positive lifestyle changes is making small changes at a time. This is why fad diets don't work. For example, you should not starve or skip meals. Skipping meals can be bad for our body because it slows down our metabolism because it thinks we're starving. In addition to our body storing away more fat than usual, we tend to make poor food choices when we are hungry or in a rush to get somewhere. Another small change that can be added to our diet is adding fruits and vegetables. If we consume 8 or more servings of fruits and vegetables per day, we have a 30% reduction in having a stroke or a heart attack. The next positive lifestyle change is to replace bad fats and cholesterol with healthy fats. We can do this by using liquid vegetable oils to cook and bake, such as olive oil, canola oil, and plant-based oils. Avoid trans fats, such as fried foods and biscuits, and other baked goods. Eat one source of omega-3 each day, like salmon and tuna, and cut back on red meats and dairy foods, and replace them with fish and chicken, and minimize our portion size of dairy products. Lastly, another positive lifestyle change is increasing our fiber intake. High fiber diets help by lowering our cholesterol, controlling our blood sugars, achieving a healthy weight, and help us live longer. Examples of foods high in fiber are whole grain breads, fruits, vegetables, beans, nuts, and seeds. So where do we start? I have 2 examples of diets that can be used as guides, the first one being the DASH diet, also known as the dietary approaches to stop hypertension. This is rich in potassium, calcium, and magnesium, and helps limit foods high in sodium, saturated fats, and sugars. Another diet is the Mediterranean diet, and this diet consists of whole grains, fruits, and vegetables, and helps decrease the amount of saturated fats that we consume by increasing our consumptions of healthy fats. A low-fat diet with exercise produces better results than a diet alone. Exercise can lower your LDL by 15% and raise your HDL by 20%. Aerobic exercises are considered beneficial for people who suffer from high cholesterol. Moderate intensity exercises help burn cholesterol and fats. Examples of moderate intensity are lifting weights, briskly walking, or running less than 10 miles per hour, mowing the lawn, and gardening. For some seniors, doing moderate intensity exercises may be difficult, but not to worry. There are other options. For example, walking to your mailbox, using a chair to help with leg exercises, and using resistance bands to help with arm strengthening. Vigorous exercises such as bicycling more than 10 miles per hour, hiking, running, jumping rope, swimming laps may be done 75 minutes per week. With regular exercise, you could see a difference in 3 to 6 months. For some patients who are diagnosed with high cholesterol, making that lifestyle change of a diet and exercise is enough. But there are other patients that may need a little more assistance in lowering their cholesterol levels. Here is a list of approved medications for cholesterol and triglyceride lowering by the Food and Drug Administration. My focus today will be on the statin medications because they have shown to have reduction in cardiovascular disease. Statin medications are used to lower cholesterol, triglycerides, and increase good cholesterol. In addition, it slows heart disease and lowers your chance of cardiovascular events. How is that, you ask? Well, statin medications work in the liver by preventing cholesterol from forming and reduce the amount of cholesterol that circulates within the blood. There are 3 different classes of statins. We have the low, moderate, and high. High-intensity statins are atorvastatin and rosuvastatin, and they are able to produce larger reductions in the LDLs, cholesterol. Statin medication should be taken at night because our liver produces high levels of cholesterol at night. So depending upon the statin you are taking, it may require food. You should continuously take your medication until your doctor tells you to stop. While statins are typically safe, effective, and well-tolerated medications, just like any other medication, they have side effects. There are few side effects that may occur, one of them being myopathy, defined as muscle pain, tenderness, or weakness. A study that was published in the Lancet journal observed 1 case per 10,000 people treated per year. Usually, it resolves rapidly after stopping the statin medication. Another side effect is liver toxicity. This is an increase in concentration of your liver enzymes. Although this occurs at very low rates, the same study has shown 1 case per 100,000. So in summary, visit with your doctor yearly and have your cholesterol levels checked. Remember, a diet should consist of high fiber, lean meats, fruits and vegetables, healthy fats, and stay away from those saturated fats. Exercise 5 times a week for 30 minutes for moderate intensity, 75 minutes per week for vigorous intensity. And seniors should start slow and progress in exercise. Statin medications should be taken at the same time every day as prescribed by your doctor. If you experience any muscle pain or weakness, contact your doctor right away. Take small steps when making changes to your diet and exercise. Results do not occur overnight, but with consistency and positive support, you can prevent and manage high cholesterol. Watch out for side effects. Here are additional resources that you may use to guide you for more information about prevention and management of high cholesterol.